got some good news for you. Unexpected surprise.
Welcome to my channel. On this channel we have a series of videos dealing with female pattern hair loss, effective treatments for hair thinning in women. The link to the playlist is above.
Guess what? I booked a ticket for two.
So today we're going to cover the use of finasteride in women. Is there a place for finasteride in hair loss treatment in women? Well, female pattern hair loss comes in various shapes and they are listed in the Ludwig scale. Female pattern hair loss distinguishes itself from androgenic alopecia basically in the fact that only the crown, the vertex and the parietal areas are affected, the hairline being retained. Treating males and females for baldness is a cakewalk. But when it comes to hair thinning, both in female pattern hair loss and in androgenic alopecia of men, though men usually respond to standard protocols in use for treating hair loss in men, effective treatment for female pattern hair loss, however, is a Herculean effort. Firstly, there are so many reasons, the causative factors for female pattern hair loss, which may not always be genetic. Secondly, and pardon my saying that, women mostly do not stick to a single doctor. Also, they are more likely to combine treatments from various sources with their ongoing treatment with a hair loss doctor. This makes female pattern hair loss very difficult to treat. Finasteride today is not infrequently prescribed in women for various indications, mostly those with high androgen level conditions like acne vulgaris, hirsutism, pattern baldness induced by testosterone used in transgender patients. In spite of the fact that studies of the efficacy of finasteride in the treatment of premenopausal female pattern hair loss is limited because of the potential risk of teratogenicity or birth defects in the male fetus, finasteride is still commonly being used to treat female pattern hair loss in both premenopausal and postmenopausal women. The incidence of female pattern hair loss increases with increasing age, affecting 50% of women above the age of 50. And as is the case with androgenic alopecia in men, female pattern hair loss is also characterized by follicular miniaturization and shortening of the anagen phase of the hair cycle. However, unlike in androgenic alopecia in men, the exact cause of female pattern hair loss remains unclear till date. The present understanding of the relation of androgenic hormone with female pattern hair loss is controversial as evidence suggests normal hormone levels in most balding female, and there is also uncertainty regarding its genetic causation. Various options have been tried for treating female pattern hair loss. Though the only approved hair loss treatment for women suffering from female pattern hair loss approved by US FDA remains 2% minoxidil for many years now. Other treatment options in vogue include tablet spironolactone, which is an anti-androgen, oral minoxidil, cyproterone acetate, topical estrogen, oral contraceptives, low-level laser therapies, fractional laser therapies, and platelet-rich plasma. In cases that are amenable to hair transplant for baldness, or when the density is quite low, provided there is sufficient scalp donor, hair transplant is an accepted treatment today. However, we have to see that when women suffer from massive hair loss and the baldness area is very large and there is paucity of graft in the scalp donor, the options for surgical hair restoration are limited because there is also a scarcity of body hair that can be utilized in women. So unlike in androgenic alopecia in men, treatment of female pattern hair loss comes with its challenges. Finasteride has been increasingly used as an off-label treatment for female pattern hair loss. Despite its teratogenic potential, several publications of finasteride in female pattern hair loss have shown positive results. Finasteride is a synthetic 4-azasteroid compound that competitively inhibits type 2 5-alpha reductase, resulting in the prevention of the conversion of testosterone to its active metabolite DHT or dihydrotestosterone in the skin, in the liver, as well as in the prostate gland. Finasteride suppresses scalp DHT by up to 43% at the 4 weeks mark, 65% at the 6 weeks mark, while treating female pattern hair loss with 5 mg finasteride daily. The bioavailability of finasteride is 80% and it is not meaningfully influenced by food. Finasteride can cross the blood-brain barrier. However, its distribution in the CSF, the cerebrospinal fluid, is insignificant. Finasteride has no effect on luteinizing hormone, on follicle stimulating hormone, but it slightly increases circulating testosterone, though it remains within physiological limits. Finasteride is classified as a pregnancy class X drug. That is, it is not to be taken by women who are planning a pregnancy or women in the early stages of pregnancy, because it leads to dose-dependent development of hypospadias, that is, genital defects in male fetuses. This is an after effect of the inhibition of 5-alpha reductase and is also seen commonly in those who are not taking finasteride but who have a genetic deficiency of 5-alpha reductase, that in these cases as well, external genitalia malformations are commonly seen. However, no development abnormalities have been reported in female fetuses. Finasteride is also prohibited in women who are lactating, that is, who are breastfeeding their children, because of the risk of its ingestion in male infants. Finasteride may be secreted in breast milk. Finasteride may also interfere with the testosterone-estrogen balance, leading to the potential risk of estrogen-mediated tumors. Therefore, finasteride should not be given in women from whom a history of breast cancer in their families is elicited. The dosage of finasteride in female pattern hair loss ranges from 1 to 5 milligrams a day. 1 milligram a day is considered as a mild treatment, 2.5 milligrams as moderate treatment, and 5 milligrams a day is considered as a high treatment for the management of female pattern hair loss. Case reports and series using various treatment regimens, various doses using finasteride in female pattern hair loss showed increased hair density and reduction of hair shedding in pre- and postmenopausal women with or without hyperandrogenism. So female pattern hair loss is a complex disease. The mechanism by which finasteride improves hair loss in women is not very well understood. There are clues, however, that DHT may downgrade IGF-1, that is insulin growth factor 1 expression, by inhibiting the release of calcitonin gene-related peptide that interacts with androgen receptors, thereby preventing hair growth. These findings suggest that finasteride might be associated with increasing levels of IGF-1 production in dermal papillae by decreasing DHT levels. Finasteride administration resulted in increase in the mean hair density without significant changes in vellus hair counts. The observed hair regrowth in female pattern hair loss may be due to reactivation of dormant telogen follicles, converting them into anagen follicles, rather than vellus to terminal hair transformation. Further studies are needed to determine the mechanism by which finasteride acts in female pattern hair loss. In my practice, I use finasteride infrequently in treating female pattern hair loss, recalcitrant cases in which other treatments have not responded, cases who are postmenopausal women who do not have a family history of breast cancer. To end, the only approved treatment for female pattern hair loss today is 2% topical minoxidil. However, this is too mild in most of the cases. It fails in most cases to achieve hair regrowth. Therefore, finasteride, a selective type 2 5-alpha reductase inhibitor, may be considered as a treatment, especially in those in which other treatments have failed. So that is the talk for the day. If you have any question about female pattern hair loss, about efficacy of various treatments in female pattern hair loss, about hair transplant for female pattern baldness, do let me know. Leave a comment in the comment section below. For a personalized video consultation, contact the number given above. Thank you for watching. God bless you. Have a nice day.
I feel stressed.